So, over the past few weeks, we've talked about weight loss medications, muscle loss, perimenopause, hormones, insulin resistance, sleep, body composition, and that's a lot of information. And I know for some people, more information can start to feel like more pressure. So, today we're going to do something different. Today is not about more things to worry about. Today is about two simple habits that you can start this week, habits that connect everything we've talked about, habits that work with your biology instead of against it, that do not require you to overhaul your entire life. So these two habits, let's talk about them and what they actually look like. Hi, I'm Dr. Lola Ashaye. I'm a board-certified family physician and founder of InTouch Primary Care in Sugar Land, Texas, where I help people, especially women, get clear, practical answers about their health, including weight, hormones, perimenopause, and long-term prevention. And as always, this is general medical education, not personalized advice. So please check with your own physician about what is appropriate for your specific health situation. All right, let's get practical. So I've had a number of patients that have tried a lot of things. They've tried calorie counting, they've tried a meal plan from a magazine, and a few different apps. But for many, it's not really a lack of motivation because they're motivated to do different things. And many of them are exhausted by the amount of mental energy it takes to follow through with all the plans, and they're still not seeing results. So, one of the first things I tell such people is we're not starting another extreme plan. We're going to find two things you can actually do consistently starting today, not 200, just two, because consistency beats intensity every single time when it comes to metabolic health. And that's what I want to share with you today. So before we get into the habits, let's quickly connect the dots from the last three episodes. So in episode 1, we learned about GLP-1 medications and that they can be effective tools, but they work best alongside a real plan. In episode 2, we talked about why protein and strength training matter for protecting muscle during weight loss. And remember, it's not just about cosmetic goals. It's also about health goals when we talk about muscle mass and protein. In episode 3, we talked about how perimenopause and the transition to postmenopause can worsen insulin resistance, can cause belly fat, and can worsen metabolism, and why standard advice often stops working. So everything points in the same direction. The body needs strategies that help it handle food, blood sugar, appetite, and energy more effectively. And there are two habits that we're going to be covering today. And these are things that anyone can start, whether they're on medication or not, whether you're in perimenopause or not, or whether you're just beginning to, or you're just trying to maintain weight management and progress. So the first habit I like to talk about is eat in the right order. Vegetables first, protein second, carbs last. And this is one of the most underused and underappreciated metabolic strategies available, and it costs nothing. Research on food sequencing consistently shows that the order in which you eat the components of a meal can significantly affect your postprandial blood sugar, your insulin response, your fullness, and the appetite hormones your body releases, even when the total calories and food contents are exactly the same. So here's the sequence, and here is why each step matters. Start with vegetables. Fiber and volume from the vegetables will slow down digestion, reduce the rate at which glucose enters the bloodstream. So starting with vegetables essentially primes the gut to absorb the rest of the meal more gradually. And then you eat protein. Protein signals the release of fullness hormones, so including GLP-1, PYY, CCK, that reduce appetite and slow gastric emptying. And here's a connection worth thinking about. GLP-1 is the same hormone that medications like Ozempic, Wegovy are designed to mimic. So when you eat protein before carbohydrates, you are supporting the same appetite and blood sugar pathway naturally. So the medication and the habit are working toward the same goal. Finally, eat the carbohydrates last. By the time the starch or sugars enter the system, the body's braking mechanism is already working. It's slowing digestion, it's signaling fullness, and moderating the glucose response. The result is a more controlled blood sugar curve, less insulin demand, and longer lasting sense of satiety. So this is not a carb elimination plan. It's not a restriction plan. You don't have to give up your, all your carbs. You should give up some of them probably, but you can change the order that they come in. So a very practical strategy and one that I try to discuss with people working on blood sugar and insulin resistance or weight management is food sequencing because it's evidence supported. It's simple to apply and doesn't require a complete overhaul of how someone eats. Okay, so let's do some concrete examples. So let's say you're eating a meal with broccoli, chicken, and rice. You want to start with the broccoli, and then the chicken, and then the rice. Same meal, different order, but you can notice it results in a measurably different metabolic effect. If you're eating, say, salad, salmon, potatoes, you eat the salad first, then the salmon, potatoes. You get the idea. So the habit takes practice for the first few days. After that, it becomes second nature, and the protein piece really matters inside of this. Make sure that the protein is actually there on the plate, not just a side thought, because it's really doing work for your fullness, your muscle, and your metabolism. I prefer plant protein as much as possible, but make sure you get your protein in. So another habit that you can start today is move for 10 minutes after meals. This one is simpler than it sounds, and research behind it is solid. So even brief movement after eating, as short as 10 minutes, can meaningfully reduce the blood sugar spike that follows the meal. Muscle contraction draws glucose out of the bloodstream and into the muscles, which reduces the demand on insulin and smooths out the postprandial glucose curve. So women dealing with insulin resistance, which we covered, last week, this becomes more, and it becomes more common in perimenopause. This habit is particularly useful because it does not require medication. It does not require gym membership. It can be done 3 times a day with very low effort. So this is not about intense cardio. This is not about hitting even, 10,000 steps. It's about 10 minutes of light movement after you eat. You can just get up and start cleaning up. That would be helpful. And this is where the threshold where research starts to show consistent benefit. So some options, we're just walking around the block, walking around inside your house or your office, light housework. Like I said, you can just get up and clean up after you eat. Just even marching in place while watching TV can be helpful. You can do a few sit to stands followed by a short walk. You can go take your dog for a walk at that point. So the goal is not for perfection. If you can do this after all 3 meals, great. But if you can do it after 1 or 2, that's still meaningful. The point is to build a consistent post-meal movement habit because over time, those 10-minute windows can add up to a real metabolic advantage. So just a brief word on sleep. We talked about this in episode 3 about how sleep disruption can drive cravings, worsen insulin resistance, and make weight management significantly harder. So these 2 habits will still help even if sleep is disrupted, but they will work a lot better when sleep is addressed. So if poor sleep is something you're dealing with regularly, especially night sweats or waking up in between 2 or 3 in the morning, it's worth raising directly with your own physician because it may be part of a larger hormonal picture that deserves attention. So if this series has given you something useful, information that finally makes things click, would you do one small thing? Go ahead and share this video and, let us know which series most resonated with you. Weight and metabolism are topics so many people are dealing with in silence. So your share might be the thing that helps someone feel less alone, more informed, and please subscribe so you don't miss what's coming next. So 2 habits you may be thinking, well, just these 2 habits, is that, can that really make a real difference? Well, like I mentioned, the research on food sequencing and post-meal movement is not about dramatic transformation. It's about consistent, cumulative metabolic benefit. Two well-chosen habits applied consistently over weeks and months really can create change in blood sugar patterns, appetite signals, insulin response, and energy. Small does not mean ineffective. It often means that it's sustainable. So if you feel like I don't have time to walk after every meal, well, 10 minutes is the threshold where the benefits start to show, in research. And that's, most people can manage that. It doesn't require, going outside. You can just stay match in place, like I said. You can, walk inside the house. You can do light house chores. So the question is not about time. It's really about building that association, intentionality, and prioritizing. So sometimes people feel like, well, the food order thing sounds too simple. Does it actually work? Well, it's good to be simple. Multiple studies have shown meaningful reduction in postprandial glucose when carbohydrates are eaten last versus first. So this is evidence-based. And that small behavioral change is worth it. Simple doesn't mean weak. Sometimes it means the habit actually sticks better. So if you feel like you've tried a lot and nothing works for you, the habits in this series, protein, strength training, food order, post-meal movement, metabolic monitoring, addressing sleep and hormones, are not a promise that any specific result will happen for any specific person. What the evidence supports is that these strategies consistently applied with appropriate medical oversight improve metabolic markers for many people. Whether they're right for your individual situation is a conversation you and your own physician would have to have. So these two habits are a starting point. They're not a full plan. A full plan looks at your labs, your body composition, your health history, your hormones, your sleep, your protein intake, your medications, your long-term health goal. So if you're ready to build that kind of comprehensive, personalized picture, that's exactly the kind of conversation we have here at InTouch Primary Care. And we offer a complimentary 15-minute meet and greet. The link is below if you're interested in that. But if you already have a doctor you work with, bring what you've learned in this series to that appointment. Ask about insulin resistance, metabolic markers, body composition, and whether your current plan accounts for where your hormones and metabolism actually are right now. And just know that, those questions you move you further along. So imagine instead of starting another plan you cannot maintain, you build two simple habits that fit your real life. Imagine feeling more in control of your appetite, your energy, your blood sugar, your body, not because you found another extreme approach, but because you found one that actually works with how your body functions. And that is what metabolic health built on real habits looks like. It's not punishment, it's not perfection. It really just is about repeated, consistent habits that with the right support behind them. So thank you for spending this month with this series, spending this month with this series. I hope it gave you clarity and helped you start with a plan that finally fits your metabolism. And I will see you at the next video.